We're here today at Capital City Vision with Dr. Colleen Phillips, and we're going to talk about some common eye problems. And the first one we're going to talk about is glaucoma. But first, I want to know a little bit about you. Can you tell us a little about yourself?
Certainly. Have been in practice for about 25 years here in Okemos. Well, 25 in the fall anyhow. My father was an optometrist before me, and so I grew up in the profession. I started off working in his office in middle school, doing charting, and then progressed into doing the pre-testing portion of the exams with him. Fought the urge to go into optometry for a couple years, then decided it really was a good fit for me. I found that I just love it. So.
Well, you're my optometrist, and I will say she gives a great exam.
And enjoy it every minute of it.
Yeah. So tell us about glaucoma. Causes, screening, what do we need to know?
Well, glaucoma is a progressive eye disease that affects the optic nerve. And the problem with glaucoma is that there's no symptoms to it. Generally, a patient's not going to come in with a complaint that they think they've got glaucoma because they have eye pressure. And that's the problem, because it can go undetected for many, many years, causing progressive damage to the optic nerve, which will could end up leading to blindness if not treated properly. There are great treatments. It's not curable, but there are surgical treatments for it. There are drops typically, and pretty easy drop regimens anymore. And as long as we're detecting it through thorough comprehensive eye exams, and it's not just a pressure reading, sometimes it is a optic nerve evaluation, visual field testing that really can pinpoint that diagnosis.
That should be part of any routine eye exam, isn't that right?
Yes, anymore, yes. Risk factors are patients who have family history for glaucoma, patients who are diabetic have a higher risk for glaucoma, patients who are very highly nearsighted have a higher risk for glaucoma. African Americans, Hispanic Americans, Asian Americans, they all have a higher risk.
Well, the other eye problem that I'm familiar with, only because my father suffered from it, is macular degeneration. Now, what exactly is that?
Macular degeneration is a progressive change in the retinal tissue at the macula, which is the only part of the retina that's capable of seeing 20/20. It is also the part of the retina that gives us our color vision. And so when that area is affected, it can cause a tremendous and debilitating loss to our daily living. It is definitely hereditary. Caucasians are more at risk than African Americans or Hispanics, and we do tend to find that it runs in a genetic pattern.
That's why I always want you to look at it.
Absolutely. Patients who are have lighter coloring, blue-eyed patients are a little bit higher risk than those with brown or green eyes. Patients who are out in the sun a lot have a higher risk. Patients who smoke have a higher risk. So the things that you can do to actively try to prevent it are wear good sunglasses, don't smoke, and having the nutrient lutein in your diet is actually also very good, because that is a nutrient that helps protect the macula area.
Now, is there wet and dry?
Yes. Dry form is a very slow progressing. We don't see fluid progressing in the retinal tissue. And unfortunately with dry, although it can cause a lot of vision loss, there's no treatment for dry.
Yeah, that's what he had.
Wet forms are where we can get blood vessel growth in there, and it causes swelling and fluid accumulation. That's actually treatable with injections. Nobody wants to think about getting a shot in their eye, but that's the best way to treat it.
Now, an eye doctor told me once that the most common complaint for patients that he sees, and patients pretty much in general, is dry eye.
Yes, it is.
And I suffered from that for a very long time. So how can we prevent that?
That's very difficult to prevent, because unfortunately where we find dryness, previously we found dryness to be a problem that really affected women. Over the age of 50, post-menopause issues would increase the dryness factor there. But we're finding now that unfortunately computers are the biggest
right?
cause for dryness because we don't blink enough. Studies show that we blink about 50 to 60% less when we're sitting in front of a computer than we do when we're just having a normal conversation. And unfortunately, that lack of blinking then doesn't redistribute your tears, and it doesn't stimulate your tear glands to produce tears. So unfortunately, I'm seeing dryness in patients in their 20s, and it just gets progressively worse because computers are bad. Winter weather here in Michigan is tough. We run into problems with certain medications, certain systemic issues, autoimmune issues, thyroid issues can also increase dryness.
So you can treat this with over-the-counter medications.
That's typically the first line of defense, or in addition to our normal tears, we put that lubricant in to help decrease the symptoms because it's a very symptomatic problem. But we find that oftentimes that's not enough. And we will find that using omega-3s, omega-7s are great to help you produce a better quality of tear film. Hot compresses for a lot of patients make a big difference. And now we have medications like Restasis and Xiidra that will also help. And it's finding which one works. Therapy is the best for the patient because not all patients fit into one single therapy.
And the thing is, when you think of dry eye, you think of your eyes being really dry. But in my case, the tears would just stream down my face because it overproduced.
Absolutely. So you have good tears and bad tears. The good tears act as part of the vision system. They help protect the cornea. They get nutrients to the cornea, and they add to the vision system. When that's not being produced well, your auxiliary tear glands kind of kick in and produce the bad tears, and that floods the eye because it's as a protector. It's feeling like there's a foreign body issue, and it's wanting to rinse that away. So.
Okay, I just have one last question. Does everybody after a certain age have the, what's the word I'm thinking of?
Cataracts.
Cataracts, yeah. Cataracts.
We'll all develop cataracts if we live long enough, yes. But now the magic age is different for everybody. But we start off our life with a very clear lens within our eye, and in our 40s as that starts to harden, which was typically when we all start thinking about needing some reading help of some sort, we start to get a little bit of a yellowish cast to that lens, and that progressively gets worse as that lens hardens more. It gets a little bit hazy. That's one type of cataract. We can also get opacities within the lens, and that's a little separate issue, but we'll all get them. Certain things, again, increase that risk. Ultraviolet light, diabetes, smoking, those are things that are going to make you produce a cataract faster than normal.
Well, I'm waiting for mine.
Some people anxiously anticipate having that cataract surgery because there are such great implants out there now that can really decrease your need for glasses in general. So, I have patients out there wanting them.
Really, I can't wait.
Bring it on.
Well, thanks so much for talking with us today, Dr. Phillips.
Okay, my pleasure. Thank you for having me.
Okay, guess we'll go back to the studio. I guess we go back to the senior center.
Okay.